Well, sadly, the red tide of the virus continues to spread throughout Ohio into every corner of this state. There's no escaping it. 82 of our counties are now classified as high incident spread counties, only 6 that are not. Every Ohioan needs to have an understanding of exactly what is going on in their own community. They need to understand what the data is, what's happened in the last 2 weeks with cases, hospitalizations, et cetera. They need to understand the extent of the spread in their community. And that's why we continue to do these press conferences. That's why we post this information up online every day. So with that in mind, let's look at the numbers for today. As we look at these numbers, I think every Ohioan needs to be alarmed by what we are seeing. As you can see, over 2,500 new cases. Again, 22 new deaths, 198 new hospitalizations, and 20 new ICU admissions. It was not that long ago when this number, as you recall, 3.5 weeks ago, it was hovering around 1,000, and we thought it was going to drop and stay below 1,000. So this is dramatically, as you can see, dramatically gone up. Let's look at our 88 counties now. 88 counties in order, all the way down. Again, this is the highest spread to the lowest spread. And again, this week we have colored in blue all the counties that are high incident counties. These are counties that have a high incidence. And again, you will see that just a handful, 6 counties at the bottom, do not have high incidence levels. Again, evidence that this is just absolutely everywhere. High incidence means the county has had more than 100 cases per 100,000 residents over the last 2 weeks. This number is the distinction that the CDC makes between a county with a moderately high level of spread and a high level of spread. We know that a high level of cases in the community just makes it more dangerous and increases the risk of catching this infection from someone else. Let's go to the top 20 counties slide. Again, these are the top 20. All areas of the state continue to see this increase. But if you look at our top counties, again, you'll see that, the first 10 counties are, some of the smaller counties of the state. You'll see some of the counties with, this is over 8 times the high incidence rate. This is, 5 times, 4 times. So you can just see that some of the very, very high incident counties are just literally off the charts. And that is certainly very concerning. Eric, let's look at the hospitalization map as well. And again, this tracks the entire period from back in April to the present. And one of the things that you'll see this color, the light blue is total hospitalization, people in the hospital. ICU is people in ICU. Vent, that's the yellow, and that's people who are on ventilators. So you can see how those numbers are moving. And again, this is a snapshot of how many people are in the hospital. So what you're seeing, of course, is a much steeper curve than we saw in June. Certainly a steeper curve than we saw before. We have seen peaks in the hospitalization before, once in the spring, and again the summer. The current increase in utilization is noticeably sharper, steeper than the increase we saw during the summer peak. Based on the trajectory of other early indicators, we've likely not yet reached the top. We have no indication that we've plateaued out at all. COVID positive utilization has basically doubled COVID positive ICU utilization has doubled from the beginning of October, and that is very concerning as well. Again, We're not to the point where any of our hospitals are overflowing, but the trend lines are not good. As you can see, this virus is spreading, and it is everywhere in Ohio. It is community spread that is driving this. When you see numbers as high as we just looked at, that indicates that virtually every county has, except 82 counties have this high spread, which means it's out in the community. The community spread endangers our schools, our nursing homes, and our hospitals. Take a look at the slide that we have right here. Is a cause and effect. Community spread caused by these things and other things lead to problems in our nursing homes, our schools, and in our hospitals. It is cause and effect. As the virus spreads in the community from gatherings where people aren't wearing masks or aren't social distancing, it is directly impacting our ability to keep our schools open, directly impacting our ability to protect our elderly, those who are ill, who are in our nursing homes. And it directly impacts ultimately our hospitals. And if it continues, and we possibly can see our hospitals overrun, things that we've seen on TV but have not yet experienced in Ohio. And it's something that we certainly do not want to experience. And again, these are some of the things that are causing our community spread. No mask, people not keeping a distance, game day watch parties now, large wedding receptions, crowded bars, house parties, extended family gatherings with extended family. These ultimately, if you worry about your grandmother in the nursing home, this community spread is how we can control it, keeping that down. When it goes up, the odds of it getting into a nursing home goes up. When it goes up and is as high levels as we're seeing in many counties today, it threatens our K through 12 schools. When it goes up, it threatens ultimately our hospitals. So what do we do about this? In the words of two great Ohio State coaches, and let me quote from them, we do need to stick to our game plan because we know it works. Ohio, when we stick together, we always win. They said it very, very well. This is a game that we must win, and to do that, we have to get back to basics. We have to get back to the fundamentals. Wear a mask when you're out in public, when you go to a store, when you're with friends. Keep your distance, wash your hands often, work on the ventilation so you're bringing in more air from the outside in your home or in the public building that you're in charge of. If you're one of the 82 counties, you live in one of the 82 counties that is now a high incident county, let's be more specific. Please reconsider hosting or attending gatherings of any size. This includes with friends and extended family, people who don't live in your household. 2, think about canceling events. Certainly don't go to Halloween parties. 3, wear masks inside and outside when you cannot social distance. Above the nose, over the mouth, secure under the chin. Stay home if you're not well. Cooperate with your local public health officials if you're diagnosed with COVID-19 or exposed to somebody who has COVID-19. Work remotely from home if you can. And we need help from our businesses. Allow employees to work from home when possible. A lot of people did that. If you can still do that, if that works, it's better. 2, send your employees communications urging them to take personal precautions to prevent the spread of COVID-19, not just during their time at work, but when they're home, when they're out and about. 3, for retail establishments, require customers to wear masks unless there is some specific exemption. Our problem is community spread. And because 82 of our counties are high incidence counties, I am today asking leaders in every single county to redouble your efforts. We've seen a lot of great leadership come out of mayors, county commissioners, business community, those in labor. We've seen people in our churches, our faith-based communities. So we've seen a lot of leadership around the state on this issue. And so thank you very, very much. Now, though, is the time to reevaluate in each single community, every county, exactly what you are doing. And so I'm asking you to pull together that group of leaders in the community, drawn from all different parts of the community. Each community really needs to reassess right now what it is doing and what it can do in the future. We are at a critical stage. Review certainly should include county commissioners, mayors, health commissioners, school and hospital leaders, college leaders, other community leaders, including those from the faith-based community, from business, and from the nonprofit sector. One of the great things about our state is the great communities and how people pull together, whether it's a large county or a small county, that people come together to solve problems. We are all in this together. What each person does or does not do will determine how well we do over the next few months before the vaccine arrives. I'm going to start meetings today as soon as this press conference is over. And we're going to start first with the 3 counties that are on the watch list. We'll do 2 of those counties today, 1 tomorrow. Then I will move to the highest of the high incidence counties. And again, we'll start with these counties and start working our way down. And again, we'll do a Zoom call. We'll bring people together and we'll just kind of talk and we'll exchange ideas. I'll be there. My team will be there to listen to your concerns, listen to where you need us to help you. And we'll tell you where we can help you. But these kind of meetings, I think, are very, very important. Now, it's going to take me a while to get down through the list, but we're going to do them as fast as we can. But obviously, in the meantime, we would ask you to pull together, set up a meeting yourselves, get on the phone, get on Zoom, get on however you can do it, and pull people together in the community, because it's communities working together that is going to make the difference. This is how we're going to beat this enemy. We have a common enemy. We have a common enemy, and that is this virus. And it's a virus that the trend lines will not change unless we change them. If we continue to do the same things we've been doing, we're going to end up getting the same results. So although many people are wearing masks, many people are being very, very careful, we need just to get our game up, and we need to get more and more people who are doing that. And this ground game, this grassroots effort, I think is really the key to getting this done. So I look forward myself to being on these calls. I look forward to talking with each and every one of you. But I'd ask you again to get started on that right away. We have the ability, working with local leaders, to offer some state support. And a lot of this we've already talked about and extended. Things such as increased rapid testing, additional personal protection equipment, help with contact tracing so people can quarantine and stop the spread in its tracks, help and guidance with air ventilation in buildings and other things. Look, we are Ohioans. We always come together. In a time of a flood along the Ohio River or one of our other rivers in the state, where there's been bad fires, when there has been tornadoes, we rally together. Our communities just come together like that. So we've got to do that in regard to this virus. We've got to come together and go after this invader, because we truly have, in fact, been invaded. If you're a county, Eric, let's look at that slide again. If you're a county with a high incidence, if you're up here, set a goal. Let's say you're Mercer at 478, or you're at Holmes with 398. Set the goal to knock it down 100. Set a goal to knock it down 200. Whatever that goal is, work in that community to get that done. Because when you take the cases down, you're going to take the hospitalizations down, and you're going to ultimately take the deaths down. It's really as simple as that. Our goal in the state should be to get every county should have an ultimate goal of getting under 100. That's the high incidence. We certainly have the ability to do that. And let's, each one of us, recommit. Let's look at our county and say, here's where we can block this virus from spreading more. We can take this action. We can do that. The ability to do that lies uniquely with you as the leaders in each one of our counties.